Welcome to the media briefing today. The doctors we have today are Dr. Edwin Choi, Controller of CHP, Dr. Albert Au, Principal Medical and Health Officer of the CHP, and Dr. Lau Ka-hin, Chief Manager of the Hospital Authority. Dr. Au will give us an update. Good afternoon, members of the public and media friends. I now report to you the cases recorded on the 17th of May by the CHP. Yesterday, there were 127 cases confirmed on PCR test. 26 were confirmed by the HA, 29 by the Public Services Laboratory, and the remaining 72 were confirmed by private laboratories. Also, yesterday, there were 202 positive cases caught via RAT. Altogether, there were 329 positive cases yesterday. So far, in the fifth wave, the accumulative number is 1,196,766 cases, including 748,177 PCR positive cases and 448,585 cases confirmed by RAT. Among the cases reported yesterday, 31 were imported. The remaining 298 were infected locally. Among the 31 imported cases, 10 were caught at the temporary specimen collection sample at the airport. 19 were found in quarantine hotels or at hospitals. 7 were caught on the third day, 3 on the fourth day, 7 on the fifth day, and 1 on the sixth and 1 on the seventh day. These cases, including those from the airport, are from Singapore, 5 of them, and 3 cases from Australia, 3 from the UK, and 3 from India, 4 from Canada, 2 from Spain, and 1 from the Philippines, 1 from South Africa, 1 from Japan, 1 from France, 1 from Vietnam, 1 from the US, 1 from Germany, and 1 from Thailand, and 1 from Taiwan. The 2 other imported cases were found on the 12th-day sample from isolation center. Both are positive cases. The first one is a 36-year-old male with 2 doses, no symptoms. On the 5th of May, he came to Hong Kong from the UK. Previously, on the 15th of March, he was confirmed to be positive in the UK. The 12-day sample measured 38 CT value. Another one is a 38-year-old female confirmed in the UK on the 1st of April. Then on the 26th of May, she came to Hong Kong and was tested positive on the 12th day, CT value 37. Yesterday, the laboratory performed 79 genome sequencing tests with no L452R strain found. 67 samples are tested to be negative against L452R. The remaining 12 samples are of insufficient viral load. Concerning previous imported cases, we have also performed genome sequencing. It is found that there is an additional case of a BA.4 strain involving a 29-year-old female with 2 doses. On the 8th of May, she came to Hong Kong from the UK. She checked into quarantine hotel. On the 5th day, that is the 12th of May, she was tested positive. On the 12th, the same day, she also presented with symptoms. Genome sequencing revealed that the strain is BA.4. So far, there are 8 cases with BA.4 in Hong Kong, all imported. Yesterday, no cases were reported by care homes. Today, from schools, 22 new cases have been reported involving 19 students and 3 teaching staff. 21 cases were found via RAT and 1 via PCR test. The sampling date, one is the 16th, 5 on the 17th, and 16th on this morning. They are from 4 kindergartens, including 3 students and 1 teaching staff, 9 primary schools with 7 students and 2 teaching staff, 9 secondary schools with 9 students. No clusters were found. Concerning mortality, yesterday there were an additional 4 cases. So far in the 5th wave, we have recorded 9,152 deaths. Mortality rate remains at 0.765. We have found no new cluster today. For those places with clusters, there are some updates. First, Tamjai, Yunnan, Misian. We have found 1 additional case. That is the 11th of May at noon, a customer at the restaurant. Today, there are 3 new cases from that cluster. 3 males aged between 31 and 33. The symptoms onset dates were the 7th and another date. One of the patients ate with a previous patient. So far, there are 6 patients from the cluster, 5 males and 1 female. They visited the restaurants between the symptoms. They presented symptoms on the 11th of 12. We have collected 16 environmental samples from the restaurants, all tested negative. Then Sky Cuisine cluster. We have found another 6 related cases, including 5 customers and 1 staff. They were tested positive on RAT. The sampling days were between the 10th and 15th of May. Upon investigation, it was found that these customers have visited the Sky Cuisine on that night. 5 customers and 1 staff. The staff member is a waiting staff. The onset date was the 12th of May. So far, there are 70 patients from that cluster, 60 customers and 10 staff. The onset dates were between the 8th and 14th of May. The Public Services Laboratory has performed full genome sequencing for the cluster. It was found that the strain is BA.2.2, which is prevalent in Hong Kong. We have also compared the genome sequence with the Saiwan cluster. The gene sequences are almost identical. And then Sun Mong Club cluster. In this cluster, there is 1 additional case involving a 70-year-old male onset on the 15 tested through RAT. There are 14 customers and 2 staff members infected. The onset dates were between 9 and 15 of May. That's all. Thank you. Dr. Lau, please tell us about the HA's situation. Good afternoon. There are 641 confirmed patients receiving treatment in public hospitals, the North Lantau Infection Control Center, and the HA's Infectious Disease Control Center. There are 7 new patients. So far, 109 patients are receiving treatments in isolation wards in public hospitals. 18 are new patients. The others have recovered, but are required to stay in hospital or readmitted because of other medical conditions. They are non-infectious, so they have been moved out from isolation wards. Yesterday, 2 new patients became critical. We have no new serious cases. Among the patients, 11 are in critical condition, 13 in serious condition. Among them, 3 critical patients are in ICU. And we have reported 4 patients who have passed away yesterday, 3 males and 1 female, aged between 64 and 90. Among them, 3 were elderly people above 65. No one came from care homes. All 4 patients did not have vaccination record. 107 patients recovered yesterday, including 82 patients who have been discharged. In the 5th wave, so far, 49,529 patients have recovered. Among them, 49,110 patients have been discharged. Since early 2020, 61,909 patients have recovered. Among them, 61,490 patients have been discharged. 2 patients were found to be positive on admission, screening, and 2 patients in the same ward are classified as close contacts. For HA staff, 22,960 staff members have been infected. Among them, 22,812 staff members have returned to the shop.
Dr. Choi, friends of the media, citizens of Hong Kong, greetings. According to the 2 doctors' reports, we know that with the relaxation of social distancing, there had been more people flow in the restaurants and in the community. And it is inevitable that there are new outbreaks. And you know that there have been new outbreaks in some of the restaurants. And we have been trying hard to look for the close contacts and also the citizens involved in these restaurants. And the number of cases would therefore fluctuate. And we see from the last few days that it is between 200 and 300 in terms of case numbers, and we do not preclude the possibility that there will be further fluctuations coming on. And we've been asked whether there are other indices where we need to monitor to show the epidemic situation in Hong Kong. Dr. Lau had talked about the HA indices, and I have some charts to show with you. According to some of the indices that we monitor, for instance, this chart here, it is about the daily new increase of hospitalization cases. Dr. Lau had spoken about this yesterday. It was 70 cases of new hospitalizations. And in the past 3 weeks, on the same basis, we do a comparison. And we see in the past 1 week, hospitalization cases, new cases is 43 to 89. And our daily cases is about 300 plus. And hospitalization rates is basically stable. And how do we calculate this? There are a few possibilities. First of all, newly discovered confirmed cases, and the symptoms merit hospitalization. And secondly, earlier on, they were confirmed and they needed hospitalization. But right now, their hospitalization is not because of COVID, but because of other conditions. Those would also be included in this calculation as well. Third possibility, the patient was admitted to hospital not because of COVID, because of accidents and other reasons, but on the other hand, they were confirmed COVID cases, and they would be included here as well. So daily, there will be 43 to 89 new hospitalization cases on a daily basis. Dr. Lau had also mentioned that for critical cases, there were 2 critical or serious cases. There were 2 additional ones yesterday. And in the past 7 days, it was between 0 to 3. Compared to the peak in March, we are at a low rate now. And this is one of the indices we have to pay attention to. In the future, even though as Hong Kong's cases may rise, the hospitalization cases and serious and critical cases, we will also monitor whether those will rise. And if so, we will definitely take follow-up action. And another chart here, we can see, it shows us under HA how many patients need hospitalization because of COVID. It's 641 cases now. Dr. Lau had mentioned that. In the past 3 weeks, it's lowered from 1,868. And we see that there are less admissions than discharges from hospital. And in face of COVID situation, this is the situation for hospitalization cases, because hospitalization, of course, affects the burden on hospitals. Of the 600 plus cases, hospitalization, 3.7% are serious cases, serious or critical cases. So that would be 20-odd cases in total. This compared to a week or two ago. At the time, the proportion was 7% or 6%. So we are at a lower rate of about 3% now. And if there should be any changes in the future, even though total hospitalization cases remain the same, but there are more serious or critical cases, we will also look at whether we need to follow up as well. Here's a third chart. And this is something that really we have to pay attention to. And this is in the segregation wards, the isolation wards. This is a very big burden on the hospital. For those who need treatment in the isolation wards, it is 109 cases. We can see in the past 1 week, it is more or less 109. And yesterday, there were 18 new cases. Of the 109 cases needing isolation ward treatment, it is about 4% of the total beds of the hospitals. So in the hospitals, we have sufficient resources to cater for isolated cases. Compared to the peak, this is also a big difference as well. Of course, if the isolation beds come under pressure, we will have to consider whether we need to take other measures. I want to tell everyone here that apart from the number of cases, there are other indices that the medical team would look at to see whether we need to take further action. So this is my report. Next, Q&A time. Would you please first introduce your organization before you raise your question? The gentleman in red, please. Greetings, Orange, Leung Hei-yin. 2 questions. The reports say that the R rate, that is the effective reproductive rate, is over 1.1. So how does CHP look at this? What is a trend, please? The 6th wave, is it going to arrive in a short time? Or, as some of the other experts say, we are just still in the tail end of the 5th wave. Some experts say the 6th wave will arrive only where there are new strains of the virus. What is your response, please, to that? Second question about the Imperial kitchen cluster. I haven't heard about new cases of this cluster. I just want to confirm whether there are indeed new cases. And also about the tracing. Are there any progress? On the night concerned, the people coming in and out of the Imperial kitchen, what were they doing there anyway? There were various versions as to what activities went on in that place. On the night concerned, how many people inside were not wearing masks? And today, there are 31 imported cases, and there is one BA.4 case. And we heard from the report that there are 8 BA.4 cases that are found in Hong Kong. Even though we have not heard from your report that BA.4 cases have gone into the community. But how exactly do you evaluate this risk? Dr. Au will talk about the cases and the imported cases, and then I will supplement on our evaluation about the trend of the epidemic. Excuse me, I have neglected to report on the following, and that is in the Kuntong Imperial Kitchen Cluster on the 9th of May evening. They have visited the venue, and today there are 6 additional cases from that cluster. Sorry, I missed that out just now in my report. Cumulatively, for this cluster, there are 26 cases, including 25 patrons, that is, visitors who went to the place on the evening, and 1 staff. And 15 cases are asymptomatic, 7 are light in symptoms, and the onset date was on the 11th to the 16th of May. And we are still investigating some of the other cases. We already know that on the night, for visitors who've been to this venue, there were 45 persons in total, and there are 4 staff members, and we have contacted them all. And we know the majority of them have done testing. Some of them have negative results. Concerning these cases, we have been asking them what exactly they were doing on the night. For the new cases today, for instance, they told us that they went there to gather with friends. But for these 40-something people, they do not all know each other. So some of them were invited by friends, and they did eat in the venue. There was food supplied in the venue, and they did take off their masks. And we believe that on the night that there was a gathering, there was eating and drinking, and people have been taking off their face masks. And in that gathering, there was a infection, and there is an outbreak. There are 26 cases so far. And we have a mandatory testing notification issued. All those who have visited the place on the night, they will have to do the testing, and we will also trace their close contacts, their family members in the same household, and they will be quarantined.
On your second question about BA.4 strain, today we have one new case. So far there are 8. All of them were found either at the specimen collection center at the airport or during hotel quarantine. None of the cases have infiltrated the community. In Hong Kong, we have maintained a stringent prevention policy against imported cases. These arrivals will be sent to quarantine hotel via a closed-loop management style with coach buses, and they will be tested every day. We would perform genome sequencing for all arrivals to try to find any possible new variants. So for BA.4 and BA.2.2.1, these are variants of concerns. All of them were caught during the closed-loop management in quarantine hotel. And also after discharge from quarantine hotel on the 12th day, all arrivals would be subject to a community test. If so unfortunate that new variants have entered the community, we will be able to nip them at the bud. When cases are identified in quarantine hotels, we would trace and step up PCR testing for all residents in the hotel to prevent cross-infection. On the other question about the epidemic situation, I understand that professors and experts in universities have put forward their views. These are all kind reminders to citizens. So concerning the possible rebound of the 5th wave or an adjustment of the 5th wave's figure, or is it the new 6th wave, it is hard to judge because our number hovered around 200 to 300, and a single cluster from a restaurant would greatly affect the number because a single cluster can come with scores of cases. So these are some fluctuation of the number of cases. I think the experts are trying to remind the public that despite the relaxation of social distancing measures, we should not forget that the epidemic is still raging on globally. As of today, the WHO still classifies the epidemic as a public health urgency. So we have to bear in mind to maintain good personal hygiene. No matter where you are, except when you are eating, you should keep your mask on. This is very important. And also you should maintain hand hygiene. The virus can be transmitted easily via contact, so you must thoroughly cleanse your hands before you touch your eyes or nose. I always remind the public to get vaccinated. If you have not, please do so quickly. If you haven't received all 3 doses, please also get it done. If you are fully vaccinated, despite of infection, you would have a lower chance to get a complication or death. We want to keep critical cases at a low level, and vaccination is a key tool to achieve to that end. We are paying close attention to the figures as well as whether the reproductive rate is higher than 1. We are worried about an impending sixth wave, but we are also concerned whether social distancing measures would be tightened again swiftly. So that's why we are trying to tell the public we are keeping tab on a lot of indexes, including the capacity of hospitals as well as number of inpatients, the number of isolation beds, and the proportion of serious and critical patients. These are all factors affecting whether we would adjust the social distancing measures. Of course, the number of new cases is a crucial index as well. So we don't have to be overly worried about an increase of 10 or 20 cases compared with that of yesterday. Remember to maintain social hygiene and do get vaccinated. In the past, we have seen a larger outbreak. So according to experts, with natural immunity plus vaccination, the hybrid model may prove to be efficient in minimizing the fluctuation in the next wave. Our key focus is on reducing serious cases and deaths. Next question, the lady in the hat. Hi, I'm from Hong Kong 01. Now, experts and the CHP or even Dr. Choi told us a lot of figures. You are all stressing that you will look at complications and serious cases as well as admission rates. Now, the number of new cases each day as well as the immediate reproductive rate, is that the key indexes, and also is a dynamic zero no longer a target. Now, for the new clusters, for the new cases in clusters, what about the seating of the new patients, and are they related to the previous patients? Now, the Imperial Kitchen, you said you would follow up on the possible failure to report. Now, it seems that there are a big gathering. What kind of gathering is it? Is it a family gathering or a company gathering, or what is that? And is it is it the case that you have found that there are 26 people in the gathering after they failed to report? Would there be follow-up actions? Now, with so many imported cases today, will we see cessation of flights once again? Now, Dr. Au, thank you for your questions about restaurant clusters. There are several clusters. The largest one is from Sky Cuisine. We have carried out a site inspection. All cases occurred on the 3rd floor at the night of the 7th of May in one time slot. There are 29 tables on the 3rd floor. On that night, there were some 220 patrons, plus some 30 staff members. Among the patrons, it is only known that 60 patrons are infected. So I think the incidents, the infection incidents happened 1 week ago, and most of the patrons have been tested. The infection rate is about 1/3, and they are spread over a large area. Most of the tables on the 3rd floor have seen infection, and for some tables, all diners were infected. So we suspect a super spreading event on that night. The spreading might be caused by a super spreader, and also there are environmental factors. We have visited the site with the EMSD. The ventilation is not very ideal. There are some corners with worse air exchange So plus the possible super spreader, and then everyone has taken their mask off, and there is definitely a risk if there was a patient nearby. Omicron is highly transmissible, and we believe that that is the cause of the outbreak. For the other restaurants, including the Peony Golden Court, as well as the latest cluster in Tamjai, Yunnan, Misian, the outbreak is smaller. And after investigation, we could not find find out the exact table number, but they are close. They are nearby and they are close to each other. We believe it was a short-range airborne transmission. We believe that an infectious patient has taken off his mask and caused the infection.
And when we found these clusters, we would issue a mandatory testing order and notice, and those who have been to these venues should, as soon as possible, do the testing so that they can be early detected and early quarantined and early treated. As for Imperial Kitchen, they have not refrained to report situation. And it was after finding the confirmed cases that they have reported the confirmation on the platform. And we have found their Leave Home Safe records, and through these records we discovered this cluster. Some of the infected know each other, but not all of them. And we have asked the cases. Preliminarily, the information we find is that this is a private meeting or gathering, and some of them have gone to the venue and they have been introduced by friends to others, and there had been eating, chatting, and we have heard that there are some business partner, business associate discussions and gathering. So that's what happened there. And we've been to the Imperial Kitchen. It is a small place, not a large place, and it is much like about a 1,000 square feet space. And it is like in a restaurant, a regular restaurant. Perhaps it is because there are infected persons, and then everybody had taken off their face masks, and therefore there were all these confirmed cases. And through testing, we find that they have been infected because many of them did not have any symptoms. Let me just supplement what Dr. Au mentioned just now. A lot of our work is continuous, and we want to control the transmission of the disease so that we will be able to lower the transmission. As for dynamic zero, we need to be focused, we need to be accurate, and we need to be scientific, and we need to be balanced in our approach. And we want to prevent serious and critical and deaths cases. So whether it is in imported cases, we have a lot of prevention measures, we have quarantine measures, and for rebound cases, we want to be able to find the close contact of the cases and to control the situation. For restaurants, we also manage and control the situation, especially where there are ventilation problems. Of course, we are doing the work. We don't want the virus to be spreading uncontrolled. So we are trying our best to control the epidemic. As for indices, apart from the daily indices at the hospitals, there are some hospital ward and beds indices. And there are other indices, such as sewer indices, that we report to the public regularly. Apart from a few restaurant clusters, perhaps there are certain buildings or community areas where there is a widespread transmission. And if so, we will have quarantine or testing orders on a mandatory basis. And if some buildings need to be evacuated, we will also do so. We have not stopped with that kind of work. And another area is that in controlling the epidemic, we see that there are some important groups of people, such as the aged or the children. If they are not protected, their mortality rate is higher. For example, in the nursing homes for the aged, every day they still have to report new cases and they have to do the RAT. We want to find new cases. And where there are such cases, we isolate them and quarantine them. For the schools, before school, the children will have to do an RAT, and the purpose is to find the children's cases as soon as possible to avoid large outbreaks at the schools. For schools, even today, we see as of now that it is effective. Where we find confirmed cases in RAT, the children not going to school would actually lower the possibility of outbreaks at schools. On the left there, the next question, that lady over there. Doctors, greetings, TVB. 3 questions for you, please. First question, the Kuntong Imperial Kitchen. There was a case that claimed that he or she was not eating. Would that be a false representation? Will you follow up? And secondly, for vaccination pass, will there be any penalties if it is not presented? Third question, if in the future, if the infected cases number increase, would there be difficulty in tracing some of the cases, and will there be any hindrances in the preventing the next wave of outbreak? All right, Dr. Au. Thank you, Dr. Choi. For Imperial Kitchen, concerning each of the cases, we would ask the actual activity that the cases undertook while they were at the venue on the evening. At first, some of the cases told us that they stayed for just a very short period of time and they were just picking up takeout food. And we asked them again because the investigation is still ongoing, and we would look at CCTV footage. Inside this venue, there is no CCTV. So we are not able to really know what exactly transpired at the venue on the night. So through their information that they provide us, we piece together the puzzle, and we now know that there were people who went up to the venue and attended gatherings. There were chats, there was eating, and they were taking off of masks, and therefore the outbreak. And for the visitors who went up to the venue on the night, we will make sure that they do the testing, and where it is positive, we will be following up and tracing. Whether we will be using the Prevention and Control of Diseases 599D to take further action, well, that depends on whether we have the evidence to prove that there are certain parties which have provided misrepresentation to authorized persons. And if so, we will seriously follow up and we will refer the case to the law enforcement department. Concerning vaccination pass for this venue, because this is not a restaurant, it is a private venue, therefore we have referred the information to the FEHD to see whether there had been any violation of any ordinances. As for case tracing, right now, there are 2 officers which are doing the tracing work. And if the number of cases increase, we will increase the number of cases. At the peak, we had 5 such tracing cases. For the vaccination pass, actually, it does help us in tracing or tracking the cases. In the early stage, we had to use invoices, receipts, and credit card information. But now we can rely on technology to help us track and trace the cases. The person in front. Now TV. Greetings. Concerning Sky Cuisine. Just now, we heard that the genetic sequencing is very close to the Saiyuan estate. So would that be the super spreader Is that related? And also for the Kuntong Imperial Kitchen, we heard that there was a case of picking up food, almond cakes. If the case actually went into the venue and actually sat down to eat, then that would be misrepresentation, right? And also, how many cases actually just picked up food from the venue but did not eat?
So Mr. R will answer the questions on the Saiwan Estate and Sky Cuisine. Concerning these clusters, we have gathered examples for genome sequencing. So the P&E Golden Court, Sky Cuisine, and the Saiwan Estate clusters, they are all local cases, as well as Sun Mong Club. The viral strains are the ones prevalent in Hong Kong. So we have compared the genes for P&E Golden Court, Sun Mong Club, and Sky Cuisine clusters. Yes, they are all prevalent viral strains. However, there are differences in terms of genome sequencing. So there's no epidemiological links between the clusters. In our investigation, we have found that one staff member from Sky Cuisine is living in Saiwan Estate. Previously, during a restriction and testing operation at Saiwan Estate, 2 clusters were found. So we have compared the gene sequences of the 2 clusters, and it is found that they are extremely similar. There is only a 1 to 2 points differences in terms of genes. Now, epidemiological link is present. That is the staff member from Sky Cuisine who lives in Saiwan Estate. The onset was on the 8th. However, his family member, one of his family members is also a case. The onset was 1 day earlier than his. Now, the Saiwan Estate cluster occurred on before the 7th of May. 23 cases are found from the building on different flags. Some cases had onset as early as the 6th. So during the RTD in the same building, some cases were found to have higher CT values. So the spreading in Saiwan Estate occurred before the 7th. For Sky Cuisine, it was on the 7th of May when we saw an outbreak. So maybe the staff member has led to the outbreak in Sky Cuisine. We do not rule that out. For the Sky Cuisine cluster, the earliest onset was on the 8th of May, including the staff member living in Saiwan Estate. For the source, we believe that he might have been infected at Saiwan Estate where he lives. It's really because the infected staff member who caused the outbreak at Sky Cuisine, well, we cannot be sure. Now, for the private diner, as I said, we will carry out an in-depth epidemiological investigation on the patrons to find out what they were doing that night. Some cases told us that they went there to fetch something without eating. So we will continue to investigate. I have nothing to add. Next question, the lady at the back. Good afternoon, doctors. I'm from Mingpao Daily. Dr. Choi, it was mentioned that if cases numbers further rise, or if serious cases in hospitals continue to rise, there will be follow-up action. So how would you define a serious condition following up? At what point will you say that the hospitals are facing pressure in terms of isolation bed capacity? So how can we decide when the 6th wave has started, since the experts are saying different things? Now, for the Saiwan Estate and Sky Cuisine situation, you said you cannot rule out an infection caused by the staff member. So Is it possible that the staff member is in fact the super spreader because he would be able to come into contact with patrons at different tables? So now restaurants staffs are subject to a test every 3 days. So should we enhance the measure to prevent infection of patrons by staff members? Now about the Imperial kitchen diner, you said that some patrons knew each other. So how many people are we talking about? Have they contravened the social distancing rules? Now I will invite Dr. Au to answer the questions first, and then I will answer your remaining question. Thank you. About the Sky Cuisine, from the 70 cases that we have found, there are 3 people with earlier onset, that is 2 patrons and 1 staff member living in Saiwan Estate. They all presented with symptoms on the 8th of May. For the Saiwan Estate cluster, it was in early May when the spreading events occurred. There were patients from different flags, including that staff member. His family members also had symptoms and were infected. So maybe it is possible that in early May at the Saiwan Estate there was a spreading event and the staff member caught the virus. So whether the staff member was the super spreader on the night of 7th of May at Sky Cuisine, well, we cannot be sure. The staff members' symptoms are mild and the RAT result was negative until the 12th of May when the PCR result from the RTD came back positive. The CT value was 32 and viral load was rather low. So maybe there was another super spreader. We cannot be sure though. We have got hold of the information of all the patrons and staff on that night, and tests were performed. The earliest onset was the 8th. So there was a gap of 5 to 6 days when the event was uncovered. So we can only presume that there was a super spreader, the identity of which we cannot be sure. The genome sequences of the 2 clusters are very similar. Still, that was the prevailing viral strain in the community. So that's why the 2 clusters share the same viral strain. For Imperial Kitchen, investigation is still ongoing. We have collated the information given to us by the patients. The conclusion is on that night there was a gathering where food was provided. A lot of people have taken off their masks. Some of them knew each other, and different groups were involved. Now, in terms of adjustments on the social distancing measures, we have to bear in mind the capacity of beds in hospitals. There are several indexes which we will monitor. First, number of admission. There is a difference between the number of new cases and the number of admission. For Omicron cases, for most people who are vaccinated, the symptoms would be mild and it is less likely for them to be admitted to hospital. The number of admission would affect the number of patients requiring isolation beds, which are limited. So the proportion or the ratio of isolation beds is an important figure to monitor. And then we would monitor the number of patients with critical conditions requiring ICU care as well as serious cases. And these figures would be affected by the vaccination rate. So many experts have given us many advice. That is, the situation at present is very much different from the situation before the fifth wave. Now, many people have the immunity after infection, and second, the vaccination rate compared with a few months ago is much higher. Of course, there are many people who are not yet vaccinated. Still, putting together these two factors, even if there is an increase of cases, those indexes I've mentioned will not see much change. Now, another factor is the viral strain. If it is still the Omicron variant, we believe the situation would not be too different. That's why we are monitoring imported cases. If new variants enters the community, the situation would be very much different. So we are monitoring these indexes to see whether we have to adjust our measures. Now the situation is at it's static at 300. Now the local infections are mostly at BA.2, so the situation is rather stable.
The last question, please. The gentleman in the back, AM 730. Concerning social distancing, Dr. Cho just now mentioned that you'll be looking at different indices to see whether we need adjustments. And some people say that they are worried that they may have certain events planned and they will not know what the future would bring. So how can you assure the citizens, or how can the people of Hong Kong plan ahead? So apart from single day new cases as an index, what else can they look at so that they can plan ahead and perhaps adjust their social gatherings, etc.? And second question concerning the Imperial kitchen situation, if there is no withholding of information, was there any misrepresentation, for instance, by some of the cases? And how many cases actually went up to the venue to fetch or pick up almond cakes? Or are you saying that among the 49 people, there are actually more people concerned in the gathering? And actually in the Siu Lam Hospital, do you have more cases reported? Do you have more or further information? And there is a Omicron case is it a re-positive case, or what is it, please? Reinfection case? Now, concerning the Imperial Kitchen cluster, as I've mentioned earlier, we do not know in the early stage during the investigation because we only had the information provided by the patients, and they told us that they stayed for a short time. Some say that maximum half an hour, some just over 10 minutes, and after picking up items of food they have went away. And many said that they had masks on and they did not eat. And then there were new cases, and new cases told us that on the day they did eat and drink in the venue. So we will be looking at each of the cases, we'll be investigating to understand what exactly transpired in the venue on the day. So that was a very good question you asked. We also suspect that there may be certain cases which provided false information to us earlier or had withheld information from us. So this is a direction the investigation is taking. So what we have to know is who went up to the venue, and we have to ensure that they have all done the testing. This is first and foremost in our work because we are in the prevention of disease, and we have to control and prevent any outbreaks and to prevent any transmission in the community. For all these cases, we have issued the isolation orders, and their close contacts and family members living in the same household, we have done the same, and including home quarantine orders. And we'll continue to monitor the situation. If in the future, if we find evidence in our investigation that there's been anyone providing false information to the authorized person or the medical officers, we will for sure follow up. I understand the citizens of Hong Kong in the past 1.5 years or over, they have been under a lot of pressure because it's caused inconvenience from the COVID situation. Now we are relaxing social distancing measures, and people are monitoring the new cases, and some of them worry that with a jump in new cases that the social distancing measure would be made stringent again. And what about wedding banquets? What about some events and gatherings? As you know, and as I presented just now, we're looking at a basket of indices. We do not want to be fixated on a few numbers and have citizens and forget that there is a lot of pressure for the citizens in social distancing. We have to balance that. Now, what citizens have to pay attention to is, firstly, if everybody can help prevent transmission or outbreaks, there are a few things we can do. Apart from looking at the numbers and decide on whether they want to go out and have meals, etc., and certainly, we do not want to do everything within this 1 week because no one can tell what the future will bring, how many cases there will be after that. There are a few things citizens can do which will really help us. One, get vaccinated, even though I'm repeating this again and again, but I can tell you vaccination would really help everyone to minimize the epidemic, control the spread. If you are vaccinated and if you can persuade your friends and family to get vaccinated, this will definitely help in controlling the spread. And secondly, as I've mentioned before, personal hygiene is very important in controlling the epidemic. Third, to properly don your masks and hand hygiene as well. And another point, please do not forget, we are still in the epidemic situation. If you are sick, go to the doctor, do the testing. Do not, if you already know that you have symptoms, still go to restaurants, still go to gatherings. And this will definitely aggravate the spreading. So if you are concerned about your future life, do these things that I've mentioned to help everyone and yourself. I reiterate that we will be looking at different indices as we make adjustments where necessary, even though we see that the number of cases are at about 300 or so, and staying at around that. We also have to look at hospitalization cases, and we need to control clusters so as to lower the number of cases as much as we can. So do not be overly worried. I ask citizens to arrange gatherings and work as you should, and also pay attention to the points that I mentioned just now. As for the hospital in Siulan, they have already done testing for their patients and all their staff, apart from the patient already announced yesterday, and also the assistant for patients. There are no other confirmed cases. Thank you. The reporter is not using the microphone. Let me just very briefly respond to you. It is very difficult to give a definite definition where it is, let's say, over 300, then it becomes a new wave. We can't do that. But we have to look at the number of cases where they start rising, whether there are adjustments that we have to make, social measures, etc. I've explained all that just now. Thank you very much for coming. Thank you.